Hello, this is Dr. Bob of Proactive Wellness and Injury Center, and in this video I'd like to discuss with you the relationship between dental hygiene and strokes, or perhaps the lack of dental hygiene and the propensity to develop strokes because of it. A few weeks ago, I did a webinar in depth about strokes, the different types, and how we can prevent it. And there is a disparity amongst most people in their thinking. They think that strokes are more or less reserved for people that are older in age, and that's not true. We're seeing a tremendous increase in the number of strokes now being experienced in younger generations, younger people. And one of the reasons I believe is because of the subject matter here, and that is dental hygiene. If you have any cavities, or if your children have any cavities, or if they have any tooth decay, then there's a tremendous probability that they or you have what's called Streptococcus mutans, a type of bacteria in your mouth. It's an oral bacteria. And research is showing us now that the presence of this oral bacteria, when they do post-mortem autopsies on individuals that have had, in particular, hemorrhagic strokes, they find that more often than not, as a matter of fact, overwhelmingly, in the percentage of time, they're finding this S mutans, or the Streptococcus mutans, is present as well. Now, what we know about this is that the Streptococcus mutans not only is the cause of the tooth decay and or the dental cavities, but what it also does is it disrupts what's called the blood-brain barrier. Now, this is a barrier surrounding the brain that actually protects it from bacteria and viruses and parasites and particular types of proteins and whatnot. This S mutans will break down. It's picked up into the blood from the mouth or whatever area. It's picked up in the blood and it's carried up into the brain, and over time it erodes the blood-brain barrier. And as it does so, it causes these little cerebral micro bleeds, where there's little areas all over the brain that are now bleeding. They're just leaking very, very minutely. And as with most things, as these bleeds continue to occur, they get bigger and bigger. There's more and more blood that's lost. And as such, the vessels get weaker and weaker and weaker until it results in a cerebral hemorrhage, until there's a huge break. And then the person has a cerebral stroke as a result of it. Also, we're seeing that these micro bleeds, and research is showing us that they could as well be an agent that's promoting dementia, because again, the micro bleeds are developing, and over time, the individual is losing his or her cognitive abilities, and then it blossoms into the condition that we call dementia. This S mutans, this Streptococcus mutans, is also responsible for heart diseases, many cases of heart disease. It's responsible for dementia, as I just mentioned, or is responsible for many cases of dementia. I'm not saying it's exclusively responsible for it. It's also responsible for many cases of Alzheimer's, for rheumatoid arthritis, and for Parkinson's disease. So we're seeing that happening here. So the bottom line here is that if you have, or any of your children have, any cavities, any tooth decay, and or gum diseases, it is my recommendation that you see your primary care physician or see your dentist, so that he or she can go ahead and address these issues. We found in our clinic the most efficacious way to do this, in conjunction with other modalities or adjunct therapies. We found that Lactobacillus paracasei is very, very powerful. It's a type of probiotic that does kill the S mutans, and we also use a purified silver. Now, I don't use, nor do I recommend, any colloidal silvers, but we do use a purified silver to kill off this bacteria. And that, along with a few other things that we do in our center, in relationship to the individual that's coming into us, because I don't want you to think that this is a shotgun approach. It's what we use for anybody, everybody. It's what you can use. You want to, again, have that audience with your doctor and or your dentist, and find out exactly what's going on with you so that you can prevent this from happening to you down the road. Because it is very, and what I'm talking about is having a stroke. Because like a match unattended after it's been lit, it can burn down the building. And if you have this S mutans that is present in your body, and if it's not addressed properly, it could result in a hemorrhagic stroke a few years from now, and we don't want that to happen. So look, I hope that this information has been of benefit to you. If you do have any questions at all, please don't hesitate in contacting us via email. You can use office@pro-activewellness.com. Again, that email address is office@pro-activewellness.com, and we'd invite you to go ahead and subscribe to our YouTube channel. And until the next video, and as always, God bless.